Alright, today we're going to talk a little bit about fascia mash. So we're going to get into all the fascia tissue area around the ankle, the foot and everything there. What we're ideally trying to look for is your fascia can get really stuck down, especially around the ankle area. So a good way to test it is just get your fingers, get it onto the skin and see if you can move it back and forth. We want to try to get as much sliding surfaces as possible. If they're really stuck and jammed up, you'll certainly feel it. It shows probably lack of hydration, lack of mobility and all that. So we're trying to restore, hello Henry, restore some of these sliding surfaces around to get that whole process working as well. We've got a bit of a connective tissue around the ankle there called the retinaculum, which kind of holds all the structure in together. So we want to try and make sure that we can keep that moving, keep it mobile as much as possible. So grabbing your foam roller, starting down around your Achilles, and now it's not like your classic foam roller, we're going back and forth. We are grabbing it and we're really just mashing our way into it. Get the skin moving on the foam roller, okay? There's no right or wrong way to do this, just get there, mash it, hold your leg, move it around, get the foam roller, move it around. Work whole 360 around the whole foot. So here I'm working around on the Achilles and the calf there, going to about mid-calf. But we also want to get into side of the ankle, but also switch foot, top of the ankle as well. So yeah, right there, I can just feel the skin moving with the foam roller. All right. So spend a good 4 or 5 minutes just on each side there. That will just help get the sliding surface moving, get some more tissue work through there, get some more mobility through the whole fascial system. Now, once you spend a good 5 minutes on each side, grab yourself, grab a band if you need to. We don't have to, don't start off with, but it's gonna go into a down dog. So everyone knows the downward position. We're gonna go for a single leg, but we're gonna get that foot flat on the ground, but we've got still that strong arch. All right, so we've got the strong arch. So from that position, I've got the foot down, and I'm just twisting into the ground, keeping that good strong arch, and you should get a good stretch up through that calf and the Achilles. Play with that position, swap the other side, and just bend the knee, straighten the knee, just play again with that position. If you want to make an extra added to it, get into the band, pop it just around the lower part of the ankle there. And again, take some slack out and do the same thing. I've got that strong arch, good neutral foot, and I'm just playing with that position. Okay, spend again good 3 or 4 minutes each side, and that should improve around there. Retest your few tests we've done before and see how that goes. Cool.